Welcome to the stage, concert pianist, director of music and medicine, and assistant professor in the Department of Neurosurgery at the University of Texas MD Anderson Cancer Center, Dr. Mei Rui.
Good evening. I'm thrilled to be here with you all this evening, and thank you for choosing to be here instead of taking a beautiful walk on the beach right now. So tonight, we're going to explore the development and the clinical applications, the scientific basis, and also recreational uses of a very powerful anti-inflammatory, brain-nourishing drug. So this drug in ICU patients, critically ill ICU patients, has been shown to reduce at a serum level and plasma level a big reduction in stress biomarkers and cytokines. So these are stress hormones and molecules you may be familiar with, like cortisol, interleukins, and other smaller cytokines that course through your blood when your body is under a lot of stress. So just 30 minutes of exposure to this particular drug, and I'm explaining a lot more because this drug is very heterogeneous. So it's been shown to significantly reduce stress biomarkers. And in stroke survivors, this drug has been shown to promote neurological recovery and help repair regions in the brain that has been damaged, as well as bring extra oxygenated blood flow to critical brain regions. And in providers, so in physicians and in other workers in acute care environment, this drug has been shown to enhance surgeon performance and help harmonize the dynamics inside of an OR. And at MD Anderson Cancer Center, we're exploring using this drug to help reduce pain, to modulate the physiological stress response in perioperative and intraoperative cancer patients. So where I'm leading and spearheading multiple clinical trials to quantitatively assess the impact of both bedside music intervention as well as immersive live performances inside of the #1 cancer hospital in the US. So by now, most of you have guessed this drug is music. So most of us know music is a powerful modulator of our mood. It can stimulate, just after a few seconds of exposure, it can create a cascade of neurotransmitter releases, such as dopamine, endorphins, oxytocin, serotonin, depending on the particular music acoustic stimuli. But the therapeutic impact goes way beyond kind of something that makes us feel good. Now there is emerging, so this emerging field of music medicine, which is actually NIH recognizes as a separate field as music therapy. So music medicine is very quantitative. We harness a lot of state-of-the-art technology, neuroimaging using fMRI and the EEG, which I'm going to show you in a later performance tonight, where we'll be doing live brain-computer mapping during the concert, and you'll be able to see region-specific activation through the performer side and also through a volunteer audience member side. So if anybody of you may be interested in becoming that volunteer later, I see some hands already, please come talk to us afterwards. So here's a little overview of what we will cover in the next 45, 50 minutes or so. So I'm going to give you a brief overview of the background, the field of music in medicine, and tell you a little bit about the program, what we're doing at MD Anderson, which both has a very rigorous clinical trial research component, and it's very multidisciplinary, and all the studies are multimodal. So we collaborate with neuropsychologists, neuroimaging, and collaborate with Grammy-winning composers, professional musicians. So really, really an amazing time to be in this emerging field. And then I want to just share with you one of our exciting studies titled Your Brain on Music. And then I will show you through some data and demonstration why live music is superior to listening to a recording or attending a virtual concert online, which became very necessary and popular during the pandemic. Additionally, I'll go over harnessing the intrinsically healing properties in classical music, specific compositional elements that we isolated, identified, and so we kind of created a reproducible and scientifically rigorous framework that could be used for future music intervention trials and studies, and how we harness music as a powerful anxiolytic. So anxiolytic means it's, in this case, a non-pharmacologic medication that reduces physiological stress, and how we use it also to mitigate pain as well. And other parameters we collect. For example, in one of our intraoperative studies, we look at the impact of music in addition to pain and physiological stress. We look at mindfulness on the surgeon side, and we look at other outcomes, for example, hope and change in mood states in cancer patients. And then we're going to move on to, I'm going to share with you a study we did where we found critical parallels between musical and surgical performance. Because I work with about 16 neurosurgeons in my department. I am not a neurosurgeon, I'm on the research side, but there are actually a lot of commonalities that may be not as intuitive to the general public that we were able to outline in this study. And then I'm going to follow that with how music may have potential side effects. So especially in fragile situations, for example, in the ER or inside of an operating room, where a surgeon may be playing very activating, stimulating death metal or very heavy techno, may help them get into the flow. But some data has shown that it could cause serious side effects like arrhythmias in patients undergoing cardiovascular surgeries, even patients who are under general anesthesia. Their body still responds through entrainment to the impact of the music. And then I'll finish with a few future directions where I hope and I envision this field to be headed. I want to start with an example. This is one of our large-scale clinical trials. It's really a groundbreaking study. It's very multimodal, so we are using proteomics and metabolomics to look at in the blood before and after 30-minute long music intervention, and how a preoperative neurosurgical patient may benefit from a type of music intervention that integrates these composition elements of relaxation. So every piece of music we use for the study is very controlled, especially the genre of classical music. If you come attend the later session where I'll do the performance, as I mentioned, it's complex, it's very heterogeneous, and a lot of music therapists even shy away from using a lot of the classical pieces. A few reasons. I mentioned the complexity. So without decades of training, it's hard to tell which of the Mozart sonatas, which of the Chopin nocturnes, which sections of a particular piece may be suitable to target a desired clinical outcome. Whether it's to rejuvenate, so you may want something more uplifting, or sometimes you might want to promote sleep. Sometimes you may want to help reestablish the circadian rhythm in ICU patients. So just being very mindful and very specific about the desired clinical outcome is really critical to success. So being very particular with the music selection. So we record all of our music for our studies, and a lot of times we modulate the composition elements. For example, I will share a little bit with you in the Chopin Nocturne, which is a beautiful piece at a slow tempo, but it may have a very eruptive acute climax that would not be suitable, that may raise the patient's blood pressure and heart rate. So we record in a way to adapt and control for these variables. So I encourage you to read a little bit more about our trials. I'll share the website in the end of the talk. So using music as a medicine, I have a personal confession to make. I have performed around the world as a pianist. I have performed a lot more concerts than I have given talks. And I usually, because I started performing at a very young age on the concert stage, so I started piano when I was 3 years old. And my first solo concert, the 4-hour, 1 hour concert was when I was 10 and a half. And it was in front of the president of Austria. So I've been very comfortable performing on stage, whether it's in front of 5,000 people or 20 people. But talking, giving presentations, I always get nervous. So, and I want you to experience a little bit of what I was describing about the heterogeneity of the music. So here you see there is a little caffeine meter going from left to right, so something very activating. No dose was something I remember when I was teaching organic chemistry at Yale. That was one of the things we synthesized. And down the spectrum to something very relaxing, like NyQuil. So I'm going to show you 4 very short excerpts, and I'll do them in order from more activating to more relaxing, and I hope you'll be able to experience the subtle differences. So first, I'm going to start with a piece by Franz Liszt. It's the beginning of a piece called Tarantella, and I will play the entire piece later in this evening's performance with brain mapping. So this is a very activating piece about a dance. There's a mythology that if you got bitten by a very poisonous tarantula, if you dance all night, you can sweat out the poison and you won't die. So this is the beginning of that very activating dance. So if you didn't get your afternoon coffee, I hope that was a little bit rejuvenating for you. And I'm going to continue with something that's more like a cup of green tea. So nice, but only not 100 milligrams of caffeine, but 20, 30. You felt a little bit of difference. That was kind of refreshing, but doesn't really activate your motor areas. And actually, some of the music could turn on your fight or flight response. Moving on to a little bit lower in the caffeine dosage, we have a Chopin Nocturne. This piece you may be familiar with, some of you. Nocturnes are wonderful to wind down. We actually use them a lot in some of dementia studies, because dementia and Alzheimer's patients, they experience something even in the late afternoon. Some of you may be familiar, called sundown. So some of the elements from this type of music can help promote relaxation and reduce agitation. And I will show my last example. That's either a cup of warm milk or chamomile tea, or maybe a pill of NyQuil. So I hope you don't fall asleep. this is the same composer who wrote another piece I'm going to perform later on this evening. Just to show you again, you cannot generalize music or choose music based on genre or composer or songwriter, but I'll show you a very polarizing example. So I hope you were able to experience and feel. Thank you. Now, since I chose only classical examples, I want to target a myth. And this is really a myth. So in a large study, I think it was over 200 participants, and this was done at Mass General Hospital in the waiting room, a surgery waiting room, where the anxiety level is very high. So it was actually, we have 169 participants. So this study found that the level of education, which has been found to correlate with usually a person's exposure to some type of music, like classical music. So the level of education is actually inversely correlated to the perceived effect of the relaxation. So what it translates to is that you don't need the training. You don't need to be a musician to appreciate, kind of on a physiological level, the stress-reducing power of music. As we design a lot of these studies, and also because I have done a lot of bedside intervention over the last few years. So prior to working at MD Anderson, I was a faculty member in Department of Surgery at Houston Methodist and Weill Cornell. So personally, I really enjoy going to the ICUs, going to bedside to perform one-on-one for the patients. And a lot of encounters were very meaningful to me because there was, for example, I'll share a couple of excerpts later during the talk, but a car salesman or content that they said they never ever wanted to attend a Houston Symphony concert or a chamber music concert. But when I played a piece for them, and then they would start conducting. So it's this visceral reaction to the music itself. So you don't really need the training or the education or the understanding of the music theory aspect to really experience the benefits of the music. And I shared with you a little bit the problem with using this genre of music is some people think of it as kind of ivory tower, very complex. You need the understanding of the harmonic, melodic structure. But the research tells us that you really don't. You really don't, especially in critical care, acute care cohorts, where preference matters a lot less than what the music actually does for your brain, for your stress hormones. I'm an assistant professor in neurosurgery, and I spearhead the music medicine initiative. My research focuses on understanding and assessing the neurophysiological mechanisms impacted by different compositional elements in music. So such as how a relaxing nocturne by Chopin may help decrease stress biomarkers in the blood, or how your favorite song by Bob Marley or the Beatles or a favorite piece by Beethoven may induce brain activation and functional connectivities, changes in your brain. I'm a classically trained concert pianist, and I've been performing for over 3 decades. And I also have a background as a molecular biochemist. I'm so thrilled to be working at MD Anderson because I get to combine my 2 great passions in life, music and research. We're developing an innovative clinical trial to investigate how music may help mitigate intraoperative stress and reduce the need for sedatives and pain medications in awake craniotomy patients. I feel privileged to have roots and connections in both the performing arts world as well as the medical community. And I envision my role here is to bring these two communities together and to developing new paradigm in music medicine research that will help fill the knowledge gap. I'm Mei Rui, and I'm making cancer history. Thank you. So that was a little glimpse of what I do locally in Houston. It's been a very rewarding 14 months. So the Music in Medicine Initiative was founded in fall of 2023. And in the last 14 months, we've had 31 world-class concerts featuring over 10 Grammy-winning, Grammy-nominated musicians. And we had orchestras. For the first time, we had a full orchestra in a sort of a cancer hospital. And we do live data collection during the performances. And later I will show you why we do these live performances, because your body responds very differently. And it's not just acoustically, but so here I want to highlight one of the studies where you see I'm wearing an EEG cap. So that's a different setup from what I will do later tonight. I brought my equipment with me. It's a dry EEG headset. It's just a lot faster to set up. Has slightly fewer number of electrodes than the one you're seeing here. So this one, the downside is the setup time is about 45 minutes because you have to gel your scalp. And afterwards, I once had to walk around in the DC airport after a talk, and my plane was delayed, so it's much messier. So this way, we will be able to really, on the spot, with my other equipment, we'll be able to recruit a volunteer participant. And we've been doing that inside the hospital as well. We can invite a cancer patient or a caregiver, and sometimes providers, as you'll see, to participate in the study. So in addition to capturing data on brain dynamics, and as you can see here, we have an audience member also wearing a headset. So we try to look at the peak human performance data on the performer side. We also compare between the difference between a rehearsal, a slightly lower stress situation, and a more acute stress situation during a live performance. Here is sitting on the left is actually my chair, and Dr. Lan, he's the chief of neurosurgery at MD Anderson. Here we have a collaborator from the Houston Symphony. He's a world-renowned percussionist and doing one of our concerts this past fall. So in addition to looking at brain dynamics data, we collect saliva samples to look at stress hormone like cortisol changes before and after the concert. Our hypothesis is that music has a very pronounced and significant impact, even just during that 45-minute to 1-hour performance. The existing literature, even though they were not in particularly cancer cohort or in physicians, they point to that there should be a difference on these critical biomarkers that indicate wellness. Additionally, we collaborate with psychologists to look at the impact I mentioned earlier on mindfulness, also on burnout. Burnout is a very significant issue, especially in physicians, nurses, and we look at changes in mood states and in anxiety. Now going a little bit into the science of what is electroencephalography, and later on during the concert, the headset I'll be wearing, you'll see 10 electrodes out of the 21 that will be highlighted. So human brainwaves are divided into 5 major bands. So we have, starting from the fastest to the slowest, we have the gamma, beta, alpha, theta, and delta. So delta, we don't really look into as much, especially for the impact of the music. That's usually a very deep unconscious state of our mind. So if you're a very experienced meditator, usually if you've been meditating for more than a few months, and you can get into the zone pretty quickly, most of them start in the low beta zone. And then over time, you'll drift into the alpha, the more relaxed state. And the really good meditators, they will even go into the theta range. So very slow brain waves.
You just click on her account.
So this is a live data collection at one of our concerts. So again, I earlier mentioned we're very specific with the type of programming we do in the hospital. So we validate a lot of our, especially if it's for a clinical trial, not as much for a live concert. With the live performances, we program more dynamic range of repertoire. But for the clinical trials, we're really particular about the type of pieces we choose, the sections of the pieces we choose, and we modulate a lot of the compositional elements as necessary. This is Dr. Stephen Buse. He's a world-renowned pianist who came to perform at MD Anderson in the last spring. And this is one of our concerts where we did the duets. So we have 4 EEG headsets, and I was trying to measure both the interbrain, so between 2 brains, interbrain synchronicity between 2 pianists, and then we also had 2 audience participants. So we're trying to look at the reaction between a participant, between performer and audience member, but also between the musicians as well that are doing the duets. And this has never been done before, to my knowledge, in the world. Okay. In the interest of time, we'll move on. You can find a lot of the full performances on YouTube. We also collect, at least we do 2 data collections, sometimes 3, that includes at least 1 rehearsal setting. So the translational implication is that we want to replicate the study in surgeons or surgical trainees. A lot of them, they practice on surgical simulators before surgery. So we want to see how the stress, the additional stress from a live operation may impact their neuroconnectivities. So the findings are, in the rehearsal, we focus more on the technical accuracy. And during a live performance, that our focus becomes more, so we're almost a little bit more in touch with the environment, with the live audience. So you can never take away the magic of a live performance because of that biofeedback. So the focus is more on creativity and improvisatory pathways. And there's the brain regions that are associated with empathy, emotional regulation. For example, the anterior cingulate, those are more engaged during a live performance versus the rehearsal. And the unique aspect of our study is that we measure the impact of these live concerts on physicians, on our care team, because most of the existing data focuses on the patients. So we try to capture the data on both sides. Here we have a lot of providers. Usually they attend our concerts. This is a collaboration with a few musicians from the Houston Symphony. And another interesting finding was that some of the more stimulating music, so in the examples I played, pieces like the Tarantella and then the Schubert Impromptu, they stimulated, they actually increased the activation in the gamma band region. So this is very critical because for those of you who may be familiar with some of the new research on dementia, on Alzheimer's, neurodegenerative disorders that's coming out, so a lot of studies, they use 40 hertz to target a patient. So they threw both visual and auditory stimulation. And they found that this type of stimulation can actually help the removal of amyloid protein buildup in the brain. And that is a huge finding because it's not a non-invasive technique with no side effects, and it has the potential to delay cognitive degeneration in Alzheimer's patients. So our hope is that through the kind of a diverse range of repertoire, going from something very relaxing to something very stimulating, we can stimulate the different needs in the brain. And a few other interesting findings were that the familiar music activates the motor cortex. And later on, I'll share a study with you that I spearheaded in surgeons to use music to help them sleep better. And we also, was a 6-week-long intervention. So they had 2 fMRI scans before and after the 6-week-long intervention, where we found significant changes in brain connectivity in regions associated with empathy, emotional regulation. So if you have ever been in a hospital or had trouble communicating with one of your providers, I think that skill and any improvement, it will be amazing for our healthcare. And unfamiliar music stimulates the attentional networks. So the trouble with the I guess one of the messages from that, the familiar music activates the motor cortex. And this results, by the way, was reproduced in also another study with fMRI, is that if you, at bedtime, if you like to listen to your favorite vocal songs with very familiar lyrics, but your motor and premotor areas may be very engaged. So that could actually potentially make it a little harder for you to fall asleep. So we actually had a study that tested the difference between prescribed music, which is unfamiliar music, and the participants selected music. So one of the surprises was that even when the familiar music or the participant chosen music was very slow, relaxing, it still activated the motor regions, especially if the pieces had lyrics, had words to it. So my advice is to avoid to use more instrumental music if you're trying to help you relax and sleep. Other experimental tools we use, I mentioned a few of these already. We also use actigraphy, which is a wearable. We use a few different technologies that are wearable wrist straps or earbuds, rings, to look at the 4 stages of sleep and how ambient music may help promote deeper sleep. We also use pupillometry to track pupil dilation and constriction through the response of exposure to familiar versus novel music or vocal versus instrumental music. And of course, we look at changes in vital signs, respiratory rate, blood pressure, heart rate variability. So I want you to take a look just visually at these 4 examples. I hope you're able to visualize that there are a lot more commonalities between the Bach melodic and the Rachmaninoff melodic versus, so the first 2 are taken from exactly the same piece. And so here, this is an argument against choosing a piece of music based on the songwriter or just based on a composer or a genre. It's really the individual composition elements that contribute to how it impacts our physiology in our brain. So this was from a beginning of a Rachmaninoff concerto, and the experimental design was the listener went into the fMRI scanner, and it will listen to their own performance of the piece. So the technical versus the Bach technical, these pieces were written more than 200 years apart. If you're familiar with J.S. Bach versus Sergei Rachmaninoff, so there are a lot more commonalities between the second and fourth, and then between the same composers.
What if it could change your brain and work as medicine? It is extremely effective for stroke victims and Alzheimer's patients.
And tomorrow night, you can watch an orchestra of physician musicians who will play a free concert while displaying a brain scan, reacting to the music. Here's Sherman Chow.
Mei Rui is a concert pianist and research scientist. She studies music in medicine. Today, she is rehearsing with, appropriately, the World Doctors Orchestra to demonstrate how music impacts the brain.
So you went into an MRI?
Yes, for 3 hours.
Dr. Rui listened to a recording of herself playing Rachmaninoff while her brain was scanned. Blue means less oxygen, red means more.
So when I'm playing very challenging or technically very difficult sections of the music, you'll actually see less activation or more blue compared to when I'm playing a very lush, beautiful, moving melody. Then you actually see my whole brain lights up.
Why is this important? Well, take stroke patients. Oxygen, which comes from exercise, helps both body and brain heal, but many stroke patients can't exercise. So, could music oxygenate the brain instead?
So the eventual goal is to be able to exercise the brain as early as possible, even when you may be partially or fully paralyzed.
The Houston Methodist Hospital researcher hopes eventually to target music to certain parts of the brain.
There's a specific region where the injury had happened.
Studies show music really does make you feel better.
Music could decrease some stress hormones that are flowing through your body, like interleukin-6, and it may even stimulate growth hormone, and that promotes healing.
Ray's brain scans will be synced to her piano concerto, then played on a big screen for the audience to watch.
Okay, I don't take up any more time. So that was one of the studies we did using high resolution from my scanner. And the next study I really want to do is to track neurotransmitter releases in both non-musicians and the musicians and see what the differences might be. Because now the technology allows us not just to look at structural and functional changes, but to also track in real time neurotransmitter releases like dopamine through the ventral striatum. So that would be a very exciting frontier for me. And one thing that was mentioned in the video you saw was the difference between something very technical versus something very melodic, and especially in musicians. And the effects maybe have yet to be explored in the audience members, but in musicians, it's more a whole brain recruitment when we play something melodic and expressive. So everything from our memory center, emotions, a lot of the sensory areas are all engaged. Versus when we play something very technical, it may look very hard to the audience. The activation is actually much more localized to the motor area and the frontal attention networks. This is a case study I wanted to share. Oops, we go back one slide. Case study I want to share with you on a stroke patient. He's actually an Irish pianist, and he suffered a pretty significant stroke. And his treatment wasn't great initially because he lives in a very small village in Ireland. And Irish pianist. So I want to share with you, so this was a brain scan we did of him at the top, listening to a piece of music he learned as a child. So he was less familiar, but he hasn't performed in many years. So you could see not a lot of, so the more blue, kind of the more oxygenated blood flow that the fMRI machine was able to capture. So not as much activation as in the second and third samples. The second and third piece is actually of comparable difficulty. If you're familiar with the Rachmaninoff piano concerti, the difference is that the second one he performed, so very familiar. He had learned and performed during his professional career, but prior to when he had a stroke. And then the last piece, the Rachmaninoff Concerto No. 1, he had to learn from scratch after the stroke. And he confessed to me how difficult it was for him to learn, not just because of the kind of the motor loss. He has suffered a little bit of that during the stroke, but his brain it was very taxing for his brain to learn the new material. Again, the takeaway message is that this could be very beneficial for anyone going through neurological recovery, because a task like this, whether it's picking up if you like to play ping pong or any sports or reading, any other activities, you should try to resume as early as possible, and even listening to music. And you could be still partially or fully paralyzed, but even exposure to some stimuli, it could stimulate and promote blood flow during those early days after you've had an operation. And it will help reestablish some of the severed connections. And again, we're very outcome specific in the music selection. So the data tells us the regions that are kind of different between exposure to familiar versus unfamiliar music are. So in the case of unfamiliar music, we found increased activation in the insula and the anterior cingulate. I have mentioned anterior cingulate before. It's a very important region that's responsible for emotional regulation and also our sense of empathy, social empathy, and affective empathy. So that region is usually very difficult to target through speech therapy or any type of physical therapy. So music is one of the very particular stimuli that could be harnessed to bring blood flow to that region in the brain to promote healing. And additionally, it's also responsible the insula is responsible for the judgment of beauty. So that, there is no scientific description on this, but my hypothesis is that because it's new music, right? When we meet a new person, we taste a new dish, of course, our judgment sensors automatically turn on. So that's the same process when we hear unfamiliar music as well. And here's a little bit more information on familiar versus unfamiliar music. So the hedonic response, or the reward response in the brain, could be tracked through the neurotransmitter release, specifically in the striatum, in the ventral and dorsal striatum. And the data shows that unfamiliar music increased activation in nucleus accumbens. Again, the nucleus accumbens and like the amygdala, it's very deep in the brain. So for EEG, it's kind of hard to capture. But fMRI and PET scans are able to track those more deeper brain changes. And the examples you see here, I was showing this slide even to a musician friend. He was like, nobody in the audience, very few people in the audience might be able to see this. But Philip Glass, Modest Mussorgsky, and Georgi Ligeti, they're all composers, and they're composing very different styles. But here we have some commonalities where we see, even though the compositions are very different, but the element of surprise, the element of novelty triggered a kind of a release of the hedonic or the dopamine response. So human beings in other settings, whether we're picking a partner or we're trying a new food, I'm mentioning food a lot because I'm a little hungry, but that response is triggered more prominently by an unfamiliar stimulus. On the other hand, when we're talking about serotonin and oxytocin, those are triggered more with familiar music, so when we're more comfortable. And so now you can think about choosing your music playlist a little bit differently. And here's one more slide, and kind of the anticipatory effect of familiar music also produces a kind of a reward response in the brain. And sometimes you may feel chills down your spine when you get that hit. It's whether maybe it's a very striking modulation or a chord in one of your favorite songs. I also want to mention something that may be lesser well known. Researchers also track our pupil dilation in response to exposure to acoustic stimuli. So we found that the surprising music or novel music induces slightly greater dilation. And here in this particular study, you can see that classical music, and to the participant, that's probably the most unfamiliar music. It produces the greatest dilation. So if we're looking at, they have these studies done in babies where they look at faces. So the element of novelty has been found to trigger a little bit more dilation in your pupils. So that was a Grammy-nominated cellist, Richard Belcher, performing one of the concerts we did together. And I want to differentiate also between kind of how musicians experience these reward responses versus how a non-musician may respond to the same acoustic stimuli. So for example, as a pianist, I find piano music, especially pieces I'm actually actively practicing, to be not relaxing at all. Even if it's a piece at a slow tempo that has all the right composition elements that we use on patients, it's not relaxing because the familiar music activates my motor areas and my fingers start moving. But on the participant or on a non-musician or even on a string player, on a professional cellist or violinist, that response may be very, very different. So know your audience is kind of key in this regard. But more universally, we found if we don't know a preference, we don't know any patient history, selecting something that falls within the vibrational frequency range of a mother's soothing voice, so think of a cello, a harp, kind of the middle, low range of a piano, those are safe kind of a common denominator that can promote relaxation. On the contrary, if we have nothing against these orchestral instruments, but a piccolo, or I play so much with the violin, but some of the upper register violin vibrato could be very, very piercing, or the oboe. So it could be too stimulating. Being very mindful of the kind of outcome you're trying to elicit is very important. So we have 15 minutes left. I'm going to move a little faster. I mentioned some of the neurotransmitter releases in the brain. These are the 4 major ones. We have dopamine, so it responds more to the novel music I mentioned earlier. And the serotonin and endorphins, they happen a little bit more if it's a familiar piece or if something in the slower and more relaxing tempo range. Now I'll share a little bit of my my beginning in that journey. I get asked a lot. When I tell people I used to practice 5-6 hours a day when I was, so my son is 8, my daughter is 6, and they practice 10 minutes a day. So I get asked, oh, did you resent your parents? Was it difficult? And honestly, I tell them I don't remember the feeling of being forced or being unhappy. I think now, knowing all the neuroscience side of things, I think my brain was constantly flooded with a lot of these feel-good chemicals. And because as a musician, you derive a lot of high, in a way, a lot of joy from playing. So that I didn't have as much time to play video games or hang out with my friends, but my brain was getting a lot of nourishment from the music making itself. This was one of my favorite memories, where I got to play a concerto for the first time, was the Beijing Philharmonic. And this was one of the Beethoven concerti. So while listening to music already activates your brain, performing music lights your brain on fire like fireworks. And our musician's brain is actually structurally different. So there was an interesting article that shows in autopsy results, the only profession where the coroner is able to identify basically what that person did for a living was a musician's brain. Because the musicians' brains are so structurally different. Even for professional athletes, that difference is not as pronounced. So there's more higher gray matter volume in a lot of these critical regions. Also, the interhemispheric, so going from left to right and right to left, the corpus callosum the connection is stronger. So musicians transmit information faster and more efficiently between the 2 hemispheres of the brain. And another big, maybe over a decade ago, people used to think music is localized to the right side of the brain, where visual art and creativity resides. But now all the neuroimaging evidence shows that making music and listening to music are a whole brain exercise. And on the topic of the benefits of studying a musical instrument, this may be familiar knowledge, and those of you who may have children, they may be learning a musical instrument. So this is the reason why even when I'm very tired at the end of a workday, through a lot of protests from my son and my daughter, I still make them sit down and do even 10 minutes of practicing. So research shows that you need to be learning for about 3 years or longer to retain that benefit, even through the child's teenage years. And they perform better, not just in gross or fine motor skills, but also in different levels of academic testing, and verbal and nonverbal reasoning, and in mathematics. So I want to share that because that was, again, one of my most memorable performances. And Rachmaninoff is a composer I had mentioned earlier. So his music is very, very dynamic. And later on in the evening, I'll be performing one of his preludes. And his music is, I would say, some of the most rewarding pieces for a musician to perform, but also very satisfying from the audience side, because it combines a lot of these elements we talked about. It has very lush and evocative melodies. A lot of you may be familiar with some of the tunes from his piano concerti. A lot of the Hollywood movies use his music. And additionally, it also has a lot of technical challenges. The concerto you just saw, that was his concerto number 3. It's one of the hardest pieces of music for a pianist. And usually after performance, I find that I'm a little bit mentally a little sharper. That was one of the reasons I tried to play a little bit for the talk as well. So my own brain is in a way a little more lubricated with oxygenated blood flow. So I really encourage you, in the morning, put on your favorite piece, and if it's hard to get up before work, and I do this to get my kids up as well. So put on some music and to rejuvenate yourself and to refresh yourself. So why are we doing these live concerts in the middle of a cancer hospital? I apologize for having to go through these relatively quickly. So live music have been found to, through stronger temporal entrainment and more significant reduction in physiological stress, it's just, it creates a more profound change through the immersive exposure. It's kind of the difference between a lot of these, now with all the virtual reality, you could take, in your living room, you could put on the headset, or one of these, we have these at home, and you can imagine you're taking a walk at the beach, it could take you to a forest, but none of them, they still pale in comparison to going on a bit of a hike or taking a walk by the real ocean like we have over here. So that's the difference between listening to a recording versus experiencing live performance, even of the same pieces. So in several of our clinical trials where we have a randomized control design, the patients or the provider will get randomized to recorded music or live music, sometimes simulated live music that's through a player piano, but with identical repertoire. We're trying to capture, while keeping everything else, all the other variables consistent, we're trying to capture the very subtle difference between live versus recorded music. So this patient is, he actually tried to turn down a couple of these bedside performances. This was one of the initiatives I launched called Music Here during the pandemic, where we brought over 400 live concerts to very isolated ICU patients. And a lot of the concerts were virtual through iPad, but we also had some later on in the pandemic in-person performances as well. But then once he heard the music through, I was performing for another patient, his neighbor in a different room, and he asked me to come over, and it was very memorable. He had never ever attended any classical concert before, so I ended up playing for him throughout his duration in the ICU. It was for 5, 6 different performances, and he will conduct me, as you saw. So, and these kind of reactions happen a lot, and you don't have to have the training, as I mentioned. So this is a glimpse of our inaugural year for music medicine. And moving on, I mentioned I want to share with you a little bit about music as an anxiolytic. And so an anxiolytic, again, to recap, it's a stimulator, or rather, it helps reduce physiological stress through the reduction of these biomarkers like interleukins, ACTH, and the MAP stands for mean arterial pressure, so it's your blood pressure. So classical music helps bring down these ICU patients' blood pressure as well as heart rate. And one of the surprising findings in the seminal study was that it actually increased the concentration of growth hormone in these post-operative, acutely ill ICU patients after 60 minutes of exposure. And the study team was blinded because they were listening to the music through headphones. So this is one of the first studies that really highlighted the anxiolytic and the biochemical pathway through music-induced anxiolysis. So the acoustic stimulus targets the cortical, the auditory cortices, and that translates to it stimulates the production of growth hormones in these very fragile cohort. So growth hormone is the indicator of healing. The more you have, the better, especially during the critical period right after you have a surgery. And that, in turn, downregulates the production of inflammatory cells and the production of stress markers like cytokines, interleukin-6, and stress hormones produced by the adrenal gland. And as a result, your blood pressure, your heart rate, and your need for narcotics, pain medications, and sedatives are also lower. Oops, can we go back for a second? So these are the hormones that were affected by bedside music intervention. And the question remains, is it Mozart specific? So in our current studies, we try to address that. So not just to select music based on composer or genre, but really be very specific in the intrinsic composition elements or qualities in the music. There are myriads of publications now on the positive impact the music can have on patients in different clinical care cohorts. Here's a little glimpse of a bedside concert by a cellist. Cellist Dr. Christoph Wagner, German cellist and a friend of mine. And so we have done a lot of these bedside performances while trying to collect data. And this is another example. The reason we love using the medium of chamber music is chamber music, compared to a full orchestral performance or a solo performance, it really highlights the power of human connection among a very small group, 2, 3, a maximum of 5 musicians in a quintet. And the human physiology, kind of the connection between the musicians, can highlight the power of music that we're presenting. Also, some of the best literature in classical music repertoire are chamber music pieces. This is where Mr. Emmanuel Axe, he's my mentor when I was at Yale University. He came to perform a free recital at MD Anderson. It was one incredible event. It was titled The Art of Musical Healing. So a lot of the patients come with their IV pose. Some of them may have just had surgery 2 days before. They come with their families. Sometimes the providers come, they had a very difficult case. So music, the power of music is immediate, and you don't need any prior training or practice to experience it. I think I'm short on time, so that's one of our player pianos that plays the simulated live music. And this is the one we are using for one of our clinical trials. So, because it's on 132 patients, so we don't have to have a musician coming at 5 a.m. 132 times to perform. So we pre-record the music into the piano, so it still emulates the acoustics of a live performance without the need for a musician to come in. And music has a big impact on surgeon performance, both tasks and also other factors like their mindfulness and the ability for them to get into the flow and to concentrate. So this was a paper I published in the journal Surgery, where we identify 5 critical parallels between musical and surgical performance. That includes, for example, something that's, think about as much, like bimanual dexterity. So the use of the non-dominant hand in the surgeon is very important, because the non-dominant hand a lot of times will be used to support suture, support tissue, and if those that have had training as a pianist, or those actually that play a lot of video games, also they are a little bit superior in that area, and that has a positive impact on their surgical task performance, both accuracy and speed. And this slide is, so if you ever have a major surgery scheduled, make sure your surgeon did not just go on vacation for more than 3 to 4 days. So the data shows that the longer they have been away, the larger the temporal distance, the higher the mortality rate, and especially these high-volume procedures. So this is intuitive for a concert musician. We will never not practice in the days leading up to a performance, but surgeons, a lot of them, they are away from the OR, and then their technical control is weaker when they come back. So here, a little bit more information. I'm happy to share this if you reach out to me, if you're interested in reading a little more about these studies. And music has side effects. For example, for patients that may have been recently divorced, and they're on the operating table, if a surgeon is playing their wedding song, for example, that could be very emotionally triggering. Or I mentioned earlier, very activating music. Also music with traumatic memory triggers could also be causing side effects. This was one of the studies. We may have, let me just check time. Are we able to go over a few minutes, or do I need to wrap up? Okay. So we're going to wrap up now. And thank you so much for joining. And